Good morning from Miami Beach, home of Neurosurgical TV. We have the honor of hosting the Krishna Institute of Medical Sciences Cranial and Spinal Trauma, Past, Present, and Future, headed by Ipe Cherian. Good morning, Ipe. We'll let you take over.
Yeah, today it has been an honor to have titans of world neurosurgery with us. So today, after the skull base dissection session, which started at 9 and lasted till now, where we went ahead and showed everything from second nerve to seventh nerve and approaches for everything from cystonostomy to right to petroclival meningiomas. We showed that. And then now we are going to host Franco, the WFNS president, Corrado, Dr. Chandrasekhar Dipujari, and all the Ramesh Nair and many more titans of neurosurgery. Vlad might join. Yong Hong is here. Yong Hong Wang is here from China. So all of these people, they'll be talking, and it's going to be an interactive meeting where you must understand that it's not like a basilative aneurysm which you see once in a while or something. Trauma is something that all of us see. All of us have experience. From the junior most to the senior most, we all have our experience. We all have our perspective. So it is going to be a very interactive meeting. And everybody, we are going to have friendly discussions. We are going to have, friendly arguments. And at the end of the day, the whole point is to learn from each other. To learn from each other, to understand the perspective of each other. And if somebody is not doing a cystonostomy, I'll ask them why they when they tell me why not, I will understand, because all of us, every one of us wants the best for our patients. So now I invite the president of the WFNS, the World Federation of Neurological Surgeons. I invite Franco Sarvadai, a very good friend, and a very good friend, for his talk and his address, inaugural address on this meeting.
Good morning, good afternoon. As is middle of the day, for you is afternoon. To our Chinese colleagues and Japanese is later. So we are now used to this form of communication. Unfortunately, the pandemic closed all the borders, and we are talking via webinar. I don't think I have written an editorial for the Journal of Neurosurgery. I don't think that all this is negative. We have realized by speaking in many webinars that the webinars allow a lot of people who are not able to come to meetings, like they didn't have the money to travel. They didn't have the money to pay the fees for the meetings, to participate actively to the webinar. The webinars are democratic. Everyone can come from. I can read you a recent webinar we had on neurosurgery and COVID. I can tell you, I have in front of me the comments from Yemen, Tanzania, Vietnam, Cambodia, Sudan, Libya, and Syria, just as an example. In this country, you cannot travel anywhere, but they have the possibility to actively take part of the webinar. So we think positively. We will never forget this experience. When we start again meetings, one part will still be on webinar because we can reach all over the world. Trauma, which our friend Ipe Cherian put today as a topic, it's the first cause of surgery all over the world. In some low and middle income countries, surgery for trauma combining brain and spine is almost half of the workload in neurosurgery. So it is important, and it is important in this period because we have to fight, for instance, in the European countries, to keep trauma surgery alive during the pandemic, because it is always a question of location of intensivists, of anesthesiologists, of neurosurgeons to open more and more and more facilities for COVID patients. But we have to understand that we have to keep our surgery alive in the field of trauma. We have to think that usually when we talk about nice surgical techniques, trauma is out. Because we think that trauma is not a surgical field. Actually, trauma is the most rewarding surgical field because we can save the life of patients who are in very bad conditions by using different techniques. What I said to you before, there are two issues here. One issue is the incidence of trauma, which I told you. The other issue is surgery for trauma. We do have the opportunity of decompression. Decompression has been shown to limit the mortality, but increase the morbidity with a large number of patients who are not able to take care of themselves, which are handicapped. This is clear for any kind of decompression, for trauma, for ischemia, for anything. Then we have new techniques like cystinotomy and like hinge craniectomy. Since trauma is more frequent in low and middle income countries, countries with limited facilities, we need to do randomized studies in these countries, or at least part of these studies should be done there, where the conditions are different. But we have the data that only at the moment in neurosurgery, only 7% of all randomized studies are done in this country. All the others are done in US or Europe. So first issue, we need to shift our studies to the countries where trauma are. Second issue, no religion, that trauma care is not a religion. So we cannot say that we have to do like this or this. We are open, but we need proofs. We need to show the people that we are enthusiastic. We want to cure trauma patient. And one method, it's impossible that the same surgery will be fitting every patient. We need to understand which is the best surgery for a subset of patients, where is best decompression, where is best cystinotomy, where is best hinge craniectomy. So we have to do studies who are not the usual randomized clinical study in high income countries where the resources are different. We need to plan a study who is fitting one part of the world where trauma is an endemic disease. And this is a task for many of us. We are very open and we want to do it. We want to show the world that we have in our hands different techniques for different solutions. And this is important. I wish all of you, unfortunately, I can't be with you only half an hour, and the first speech which I should do, Corrado will do it, obviously sharing with me the presentation. I will be with you about half an hour, 45 minutes, and I have other business in the hospital. Unfortunately, in Italy, we have new pandemic, very high number of admission in the hospital, and we are quickly reconverting again our activities. The disaster of March is again with us. It's different, but it's again. So we have a lot of things to do. But I wish all of you a fantastic day and a very good teaching. Thank you, Ipe, for giving us this opportunity.